Well, when you think of February, do you think of Valentine's? Well, doctors want you to start thinking about paper hearts, or beyond paper hearts, I should say, because February is American Heart Month, and it's a time to focus on heart disease. It is the leading cause of death in this country. Our Caroline Vandergrift with one man's story of survival and the risk factors to watch for.
Bobby Watkins always wanted to work in healthcare.
I love helping people.
With a family history of serious illnesses and his own health complications, it's easy to relate to his patients.
It's because I know exactly what they're going through. I know exactly what they're feeling, their thinking, the fears, their anxiety, their anger at the whole situation.
Emotions he had to cycle through again at the end of last year.
I was at the gym and I was doing my arm curls and I started feeling this extreme pain going up into my neck and my jaw.
He went on with his routine, but the symptoms came back a few days later, this time with shortness of breath. That's when Watkins knew he needed to see a cardiologist.
He ended up having multiple vessels that were blocked, which is fairly uncommon under age 50 to have coronary artery disease, and having multiple arteries is even more uncommon.
Watkins needed triple bypass surgery to save his life. It would be his 32nd procedure, and he'd never been more afraid.
I can handle the leg amputation and the kidney transplant, that's easy, but we're talking about something that keeps you alive, and you can't live without it. So that was extremely scary for me.
But the surgery went well, and Watkins is now back at work and back at the gym.
It's a new lease on life.
One he wouldn't have gotten if he didn't pay attention to his symptoms.
What I hope everyone will learn is that they need to listen to their body. And if it doesn't feel right, then there's something not right. And you should do something about it.
Coronary artery disease affects more than 20 million adults in the U.S., according to the CDC. Dr. Tulika Jan says if people get to a cardiologist early enough, there are lots of treatment options besides surgery.
Paying attention to the symptoms and paying attention to your risk factors are very, very important. Things like diabetes, your cholesterol, blood pressure, smoking is a big risk factor.
Watkins is now eating a heart-healthy diet and continuing to exercise 5 days a week as he faces his ongoing medical issues.
Because of that and everything else I've been through, my body's kind of beat down. But I won't let it beat me. It won't beat me, for sure.
Because his ultimate goal is to become a nurse practitioner.
I love to heal people.
To keep helping others. In Dallas, Caroline Vandergrift, CBS News, Texas.